Hello there, this is Dr. Mintz. I wanted to discuss the couple of unknowns that I had sent you, and pretty much all of you have responded to that, to both of those. I want to again impress upon you that what I'm looking for is just simple, succinct description of abnormalities, not diagnoses. It's an important skill that I think we will be building upon over the next couple of years. So here, starting out, is a small bowel follow-through. And when I show a case like this, it's not going to be anything tricky or subtle. There are obvious abnormalities, these areas here and here and here, and less obvious over here. So how do you describe them? So my goal in this pursuit is to develop your ability to just briefly describe what kind of abnormality you're seeing. So if you were to do the study and you were in the other room and the radiologist asked you, what did you see, that you can give them a brief, succinct description. So the first question to ask yourself is it normal or abnormal? It's abnormal. Fair enough. What is involved? What anatomy is involved? Small bowel. So this is jejunum, and I'm not sure if this is distal jejunum or if we're getting into ileum here. The mucosal folds seem a little discrete and well defined here to be terminal ileum or distal ileum, but they're small bowel filling defects. That is what we're seeing here. What I would say about this is there are multiple small bowel filling defects. Best visualized, you could say, in the left side of the abdomen, which is presumably more proximal jejunum. But even apart from that, suffice it to say that this is an abnormal small bowel follow-through revealing multiple filling defects in the small bowel. Over to the right here, you see what are kind of filling defects, but you can see more clearly that what you actually have here are thickened mucosal folds, which might make you think that what you have over here are very thick mucosal folds. Fine, but we don't even have to go into that. There are multiple small bowel filling defects. What else can you say about them? They're smoothly marginated. They're not irregular or craggy or spiculated. So, let's say that there are, a good answer to me, if I were to send a case like this to you, is there are multiple small bowel filling defects which appear well marginated or smoothly marginated, and there appears to be some mucosal thickening involving portions of small bowel in the right side of the abdomen. Period. It's great. That is all I'm looking for, is those kind of simple descriptive terms, and I really don't want you to worry about what it could be at this point. We'll be going through all kinds of differential diagnoses in this course and as the program progresses over the next 2 years. But here I just want you to be able to describe abnormalities and not worry about the diagnosis. And it's probably best just to leave it out entirely. I will give you ideas about what it could be or what it is. In this case, these are multiple small bowel lipomas. They could equally be adenomas or polyps, adenomatous polyps, related to one of the adenomatous polyposis syndromes. They could also be small bowel metastases. This could also be very pronounced mucosal thickening, but the fact that it's only involving one side of the bowel and not the other, and the same is true over here, argues it against it being some kind of edema or inflammation or infection, something like that, or hypoproteinemia that causes increased edema within bowel wall. Here again, we're getting farther than we need to, but suffice it to say then that this is a case of small bowel follow-through showing multiple smoothly marginated filling defects in the small bowel with relatively mild to moderate mucosal thickening in the small bowel on the right side of the abdomen. Could be adenomas, could be metastases. In this case, it happens to be lipomas. So focus on that aspect, meaning the descriptive terminology. Okay, here we have a barium swallow. Now this is a tough one because you just have two views and you're never sure how much of an abnormality that you're seeing that looks like this, where there's relatively poor filling, how much is just the phase of contraction of the esophagus versus a real abnormality. But there again, in this case, I just want you to make a stab at it so that you can use terminology, and I can hear the terminology you use and make suggestions. So in a way, it's better if you make mistakes. Say a few words that describe it, and I'll say, oh, that's okay, that's pretty good, but this would be a better term, that kind of thing. So in this case, what do we have? Well, we have a barium swallow showing what looks like a pretty normal appearance proximally in the esophagus. Here, looks like maybe it's abnormal, it's not filling well, but here it looks irregular. So we have poor filling with irregular margins. If you look here, you see how it's kind of an irregular border to the esophagus, and even here you have these little tiny outpouchings, a little hard to see, that could be small ulcerations. The fact that on both of these views it looks like you're not distending the esophagus well suggests that there may be some narrowing, an abnormality involving narrowing of the distal esophagus. And even here, if you look at this is a little filling defect or an impression upon the esophageal lumen, and you see it here in another perspective, another projection. But it's not so much this particular case and trying to describe it completely and fully. That's not what I'm looking for. I just want to see what terms you use. And in this case, I would say there's poor filling of the distal esophagus with irregular margins of the esophagus, and the areas of poor filling could be related to mucosal edema that's effacing a part of the esophageal lumen. They could be small masses. This could be an infectious esophagitis. This could be a reflux esophagitis, maybe with the early development of Barrett's esophagus that potentially is even starting to create the pre-malignant changes. So, suffice it to say that this is an abnormal esophagram, and there is poor filling of the distal esophagus with narrowing, which may or may not be persistent or real, but it doesn't matter. The point here is to just describe what you see. It's a somewhat narrowed distal esophagus with irregular margins and possibly some filling defects. That would be perfectly adequate for our purposes. Okay? And then, with no further ado, I think you can see my friend Max back there. Max is my best friend, and he can come over. Come on, Max. Come say hello to my friends. Come say hello. Hop up. Hop. Hop. There you go. Yeah, Max is 5 years old. He's a golden retriever, and he likes to teach too. Okay, guys. Talk to you again soon.